Today in Health IT, how well do we know our clients, our patients? My name is Bill Russell. I'm a former CIO for a 16 hospital system and creator of This Week Health, set of channels and events dedicated to transform healthcare one connection at a time. We want to thank our show sponsors who are investing in developing the next generation of health leaders, notable ServiceNow, Enterprise Health, Parlance, Certify Health, and Panda Health. Check them out at thisweekhealth.com/today. Hey, this news story and every news story we cover you can find on our website, thisweekhealth.com/news. Check it out today. Finally, share this podcast with a friend or colleague. Use it as a foundation for daily or weekly discussions on the topics that are relevant to you and the industry, a form of mentoring. We're going to keep on this topic. We would love to have you mentor someone. They can subscribe wherever you listen to podcasts. All right, let's get to the article. Article's interesting. So this article comes from Jared, a Chartist company, and they did a survey, and there's 5 takeaways on healthcare consumer preferences. This is so important. We're interacting with the consumer more and more with our technologies, and it's important to understand how they think about things, how they're viewing things. And so the Jared team did a survey, a national 2024 National Consumer Survey Series, which explores what leads people to choose their providers. How do they prioritize factors such as location, appointment, wait times, availability of digital tools, and even demographics of clinicians and staff? And do they care about online ratings and reviews and so forth and so on? So they do this study, and let me give you just a few insights into it. The first is providers are talking past patients when it comes to quality. This one was interesting to me. And again, some of this is not technology specific, but it's more just in general of understanding our consumers. This one was interesting to me because we throw out all these ratings. Number 1, number 2, number 5, U.S. News and World Report, whatever ratings we get, 5 stars, 10 stars. The reality is the patients don't understand these ratings. Now, you might use those ratings for clinicians to attract clinicians and bring them in as a top-ranked institution. But at the end of the day, when the patient is looking at these things, they're not looking at the external accolades. Instead, they are looking at the caring personal experience that patients have when they are in the room. It makes sense. They want to know that someone's listening to them, someone's caring for them. So when they think about quality, they think about quality from a personal perspective. They don't think about how you ranked in some survey. They think about those personal aspects. Again, I think these insights are interesting as we develop tools, as we think about the connection with the patient. The second thing, insurance convenience and good reviews matter most when thinking about choosing a PCP. Whether looking at a PCP or specialist, over 80% of people say that finding a provider who accepts their insurance is very important or important. Beyond those table stakes, though, about 70% said that a convenient location is important to finding a provider, with just half giving strong credence to good online ratings and reviews. And we used to spend time with our clinicians on the online ratings and reviews and how they could improve them, knowing full well that social media and reviews like that do make a difference when people are finding a provider to work with. The third, relationships are vital in sticking with a provider. And most who have switched PCPs in the past 2 years said they did so because they or their doctor moved or they had changed their insurance status. So there's an energy barrier, there's a momentum barrier to making a switch. Yet even, or perhaps especially, when a change must take place, building a relationship matters. One respondent noted, I didn't like my PCP. I inherited her when my PCP I had been seeing for 30 years retired. So there is a certain incumbency factor with regard to the person that you're working with. Finally, and these last two are specific to technology, virtual care is well regarded, but not a panacea. Consumers who use virtual care are happy with it. Just under half the people have had a virtual care visit in the past 2 years. Among that group, more than 90% said that they were very or somewhat satisfied with the experience. That said, a significant portion of the population isn't clear on their options. 3 in 10 were not sure whether their health plan offers virtual care. About one quarter said they didn't know if their PCP or specialist even offered the option. Among those who chose not to use virtual care, 55% said it was because they prefer having a face-to-face time with their doctor, reinforcing the personal, relational nature of medical care. Okay, so people aren't using it because they don't know about it or they don't know what their options are. So it's important to educate the user. And then finally, healthcare consumers are in a transitional moment with digital tools. Over half of the people surveyed have used an app or website to schedule a medical appointment in the past year. At the same time, exactly half say that if all options were available, they would prefer making a phone call to schedule or cancel routine appointments. That's interesting. Here's their takeaway on that. As with virtual care, providers need to balance digital and analog scheduling methods, maintaining or strengthening phone support while expanding use of online tools. Additionally, it is worth considering how to better educate and equip patients to become more comfortable with digital tools. Of course, none of this matters if those tools aren't offered or if they lead to a dead end, such as an inability to get an appointment. The only thing, as I was reading that one, the only thing that really jumps off the page at me is there's, as is always the case when people come to the technology people, there's no regard to cost. Hey, strengthen your online tools and your website and your mobile application. Oh, by the way, and maintain a strong and robust analog method, meaning staff up that help desk or 2 help desks and use all those tools associated with that. I don't think we have these luxuries as much anymore. We've got to pick a lane, really invest heavily in that lane, and move people towards that lane that is more efficient. The bottom line is that healthcare is struggling financially. Maybe not everywhere, but almost everywhere I've talked to people, healthcare is struggling financially, and it's important that we don't act like there is an unlimited source of funds, because there is not. And to a certain extent, it's important to work with marketing to educate the community. It's important to work with the clinicians, help them to understand the financial realities that are coming down the pike and how technology can support and assist that, and help the institution as a whole to pick lanes, to understand the cost and the burden of choosing multiple lanes. While it feels good and everybody gets a yes, it doesn't feel good in the long run because it creates a suboptimal experience, substandard experience, because you can't invest in all of them. You can't make any of them great experiences, and so you have mediocre experiences across the board. So again, important to pick a lane, and that's probably the hardest thing that I would say needs to happen within healthcare is when you're talking about picking a lane, you run into politics, you run into people, you run into fiefdoms, you run into pet projects, you run into all those things. But that is the work of the executive leader in healthcare. That's the work that only the CIO can do, and maybe the senior IT leadership teams, is to work with the healthcare leaders to help them understand the ramifications of their decisions. And that's a majority of the job. Organizational change management is a majority of the healthcare IT leaders' job today. All right, that's all for today. Don't forget, share this podcast with a friend or colleague. Use it as a foundation for mentoring. We want to thank our channel sponsors who are investing in our mission to develop the next generation of health leaders. Notable: ServiceNow, Enterprise Health, Parlance, Certify Health, and Panda Health. Check them out at thisweekhealth.com/today. Thanks for listening.